Hello and welcome to episode 5 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix, online low back program. And today's topic is centralization for your sciatica. What is centralization? How can we learn about it? How can we achieve it? How can we fix our low back issues, specifically our nerve pain? So many individuals struggling with disc herniation or sciatica notice that they're obviously getting those symptoms down the leg. That sciatic nerve pain traveling down the leg. You're probably experiencing worse days, it goes farther down the leg. Better days, it goes less down the leg. It's kind of like it can vary the location in the leg depending on the day, right? Now, for some individuals, it might be segmented, meaning that there might be a chunk of nerve pain in the glute, it might skip the thigh, there might be a chunk in the back of the knee, it might skip the calf, and then a chunk in the foot. Sometimes that can happen. Another scenario is, let's say someone has symptoms down to the calf. It'll be like one solid line that they can draw from the low back or from the glute all the way down the back of the leg, down the back of the knee, down to the back of the calf, or sometimes the side or sometimes the front of these regions. But it'll be a single connected line. That or the other option, the segmented variation where it's in different portions of the limb. Now, what can happen here is you might find that certain movements increase the symptoms down the leg. It goes further down. So if normally, let's say on average, your symptoms are going down to the back of the knee, okay? And then you wake up one morning, it's a particularly bad morning. You get up, you start walking around. Normally these disc issues, normally these sciatic issues are worse in the morning, right? For most people they are. And they notice, oh gosh, this morning my symptoms are going all the way down to my foot, where normally they're averaging about the knee. Now they're going down to the foot. That is an indication that the nerve is more irritated, or the disc around the nerve is more irritated. And that is causing the symptoms to go further down the leg. So the further down the leg the symptoms go, the more irritated the nerve is. Now the opposite scenario, someone normally has symptoms around the knee, and they wake up one morning, and it's a good morning. They're like, oh my gosh, symptoms aren't going down the knee today. They're only in my, let's say my glute. They're only in my glute. So it's not going through my thigh, it's going through my glute, and that's it. That is a good sign. That means the nerve is less irritated because it's not shooting as far down. So that nerve is a little bit calmed down, that disc is a little bit calmed down, and you feel better because of it. So how can we use these signs to inform us on our treatment methods, in our rehab methods? Here's how. So if the symptoms travel further down the leg, this is referred to as peripheralization. It is traveling further towards the periphery. If the symptoms go less in the leg, so it is normally in the knee, but now it's only in the glute, less in the leg, it's traveling towards the spine or towards your trunk, that is called centralization. Centralization is what we want. That is what we want to achieve. Peripheralization, not what we want. That is the opposite of what we want to achieve. So if you are dealing with these issues, you might happen to notice that if you have sensitivity to bending forward and you're trying to do let's say a heavy leg workout, and you're doing some like leg presses or squats, and you're kind of rounding, you're doing core stuff, a lot of sit-ups, a lot of crunches, you might notice that those symptoms will travel further down the leg. That means those particular movements that you're doing are peripheralizing the symptoms. So you don't want to do those ones, at least not right now. Those movements are going to make things sensitive, and you want to lay off those. On the other end, you might find that there's other stretches or maybe other core exercises that will make the symptoms less in the leg immediately after. You're like, hey, before I did XYZ, they were in my knee, and now I just tried XYZ, and now they're in my glute. Well, that is a great sign. That means you need to continue doing those movements. Those movements are your friend. Your nerve likes them, your disc likes them, your low back likes them, and those should be included in your rehab program. So what's very important is when you are putting together your rehab plan, if you're on your own, you're trying to do this solo, you need to keep track of the movements that cause peripheralization, and you want to exclude those, and then pay attention to the movements that are causing centralization and include those. You want to keep those in. So sometimes you might get stuck on, hey, you got all these movements, you know they cause centralization, but it's not going any further beyond that. And that's when you reach out to an expert, you find someone that can help you get to the next level, right? But if you're doing this on your own, you want to take close note to this, because you don't want to continue to perpetuate your cycle. You don't want to continue to go down the wrong path and flare up and flare up and flare up. This is not what you want. This isn't what I want. This isn't what anybody wants, your family, your friends. Nobody wants this for you. And if you are seeking help from a healthcare provider and you perceive them to be an expert, make sure that they are assessing your movement. Make sure that they are taking you through a mechanical assessment and determining, okay, which movements peripheralize your symptoms, which movements centralize your symptoms, and make sure they are organizing these for you to teach you, all right, these movements we don't want to do right now, these movements we do. Because this is what's going to set you up for success. If you focus on the movements that centralize symptoms and you progress them and you progress them and you progress them, that is going to get you to where you want to be. Because eventually those symptoms are going to stay away. Eventually the low back will recover if it has the opportunity to, right? Spine model fell down just then. That is what you want to happen, okay? So the analogy I give to this is, imagine that you have a paper cut on the top of your finger, your knuckle, okay? Now imagine I am bending that finger nonstop, constantly bending it. That paper cut is gonna have a hard time healing, right? It's not gonna have a lot of opportunity, all right? But if you take it the other direction and you don't bend it, you extend it, and now all that skin is wrinkled together, it's smushed together, that paper cut is going to have an opportunity to seal, okay? So in this situation, if I know that bending my finger over and over and over, if I understand that that movement is not the right one for my knuckle, I know to avoid it. And I know to go the other direction, do this other movement, because that is going to give my low back an opportunity to heal. And then just like a paper cut, that doesn't mean I have to avoid bending my finger for life. That is not true at all. Once that cut is healed, once my low back is healed, then I should be able to return it to those original exercises that didn't feel so good. You should accurately assess where you're at in this stage of recovery and make sure you adequately get back to full function. You're not going to be stuck with your finger in one position for the rest of your life, just like you're not going to be stuck with your low back in a position for the rest of your life. You need to be able to get back to all movements and be confident with all movements. But there's a period of time where you need the right rehab to get you there. So we want to focus on movements that centralize our symptoms, that pull the symptoms out of the leg. And we want to temporarily avoid movements that peripheralize our symptoms and that are increasing that nerve sensitivity. I hope that you learned something from this podcast. If you did, please rate, review, subscribe, help us reach more people. And don't forget, if you are struggling with low back issues, please reach out for help. And I would be honored to help you find relief in a fast and effective way. Have a great day. Thank you for listening.